Hello, everyone. I'm just going to give it a couple minutes for people to log in, and then we'll get started. All right, well, why don't we get started with introductions before we jump into the meat of this. Thank you all that are logging in and those of you that are coming in. The subject today for our panel is the future of healthcare delivery, innovation, automation, and the emphasis on the human element. When I first saw the title, I was like, wow, look at the disparity of those words. Innovation, automation, and the human element. It took me a minute to wrap my head around how we're going to do this. But I think it's so important that last piece, the human element, is in. And as I was getting ready this morning, literally at about, well, I'll tell you, at 12:01 p.m. today, I got an invitation to a webinar on 5 simple ways to humanize the hospital experience for the benefits of all concerned. So it's going to be a very important element going through all this as we're talking about processes and innovation and leadership, the human element. My name is Susan Albano. I am the CEO of Prime Healthcare in Connecticut. We are an 80 provider, multi-specialty private practice. We are not owned by a hospital or any system. We are independent and work very closely with our Trinity Health Ministry in the Hartford area. And I will turn it over to Mark to introduce himself.
Thank you, Susan. Mark Johnson. Very happy to be with all of you today to, like Susan said, go through something that I'm kind of like her, thought that this was like, wow, kind of 3 almost very distinct, if you will, kind of pillars that we're going to try to blend together today. I've been in healthcare for almost 30 years. I'm currently an independent healthcare finance and strategy consultant or advisor. Interim right now as the CFO for Carewell Health in New Jersey. But prior to that, I have worked in the investor-owned world. I've worked in the not-for-profit world. I've worked for large academics, either as a chief financial officer, a chief operating officer, or a chief revenue officer. So very happy to be meeting with you guys today.
Very good. Tom?
Good afternoon. My name is Tom Nestrick. I am the Senior Vice President and Associate Chief People Officer for Advent Health. We are a not-for-profit, faith-based healthcare system headquartered in Orlando, Florida. There, my team supports our 95,000 team members spread out over our 50-plus hospitals across our 9 states. And it's a pleasure to be here today with my fellow healthcare colleagues.
And Yuri.
Hey, good afternoon. My name is Yuri Pastrick. I'm the Vice President and Chief Nursing Officer here at St. Joseph's Health, located in Syracuse, New York. We are part of Trinity Health of New York, regional ministry, as well as the larger part of Trinity National, which is headquartered in Michigan. We oversee we are a tertiary care facility and about 2,500 colleagues active, and I oversee primarily nursing operations and support in clinical operations, both here locally as well as regionally in the New York State area.
Excellent. So I think you can see by these introductions, we have representing many aspects of healthcare management here, right? We've got finance. My background is really in strategy. We've got human resources, the chief people officer, and then clinical, of course, with Yuri. So I'm so happy we have that broad perspective as we tackle this. So let's start with, I want to take the 3 main concepts in here: innovation, automation, and human element. And let's sort of attack them, and then we'll see how we can put them all together at the end. Innovation first. And let's take, we're looking at an environment in healthcare that has been through, it's trite to say so many changes, right? I mean, we're coming out, we're out of the COVID area now, but we're in this amazing time of advancements in data science and automation and all these things that can revolutionize and really change how we do things. And I want to know, you're all leaders in your field and leaders in your organizations. Tell me how your leadership, how you adapt in your leadership. What is your strategy for being able to embrace new opportunities, innovation, new ideas, while continuing to run the business and keep things going? So I'll let any one of you want to jump in and go first, but talk to me about leadership and innovation and how you use your leadership skills to embrace innovation, but keep things running. And if someone doesn't jump in, I'll call them. Good, Tom.
I'll start from a people perspective. I'm sure Mark and Yuri will tie in to what I'm about to discuss. But first and foremost, I think you're thinking about innovation, and Susan, you have to look at in each of our, respective areas, how that ties into your overall business strategy. And I'll give you a specific example. So from a people perspective, working through COVID in healthcare is probably, it's been unlike anything I've ever experienced in any type of work in any industry. And I'm sure my colleagues agree here, but from a people perspective, it brought up, unforeseen challenges. Let's just talk about, for instance, staffing and retention. The last 3 years, that's probably been the, focal point for most CEOs of any hospitals. And it's because of the impact of COVID, as far as, nursing shortage, nurses joining agencies, agency utilization, at its highest peak, which of course means high spend, right, for most healthcare systems. And now that we've come out of it, we're all trying to recover from that and do so as quickly as possible, right? Because that directly affects our financial performance. So when I think of innovation, I think of how do we tie it into our overall strategy, which in that example is, of course, reducing agency, filling jobs, to put it simply put, and keeping the employees that you have, right? Three core elements of healthcare as far as from a human resources perspective. And so at Advent Health, when we were looking at innovation, I'll tie technology into this. From a people stance, we recently, about 7 months ago, implemented our first type of AI technology in our talent acquisition space. And the reason we did that is because we were looking at obviously remaining competitive in the hiring landscape. How do we fill those gaps quicker, faster, and more efficiently than our competitors, right? Which in turn helps our overall business accomplish those things that I mentioned as far as reducing agency and spend and filling vacancies and those things. So by implementing this technology, we over the past 7 months have been able to accomplish literally all three of those things. We've seen a dramatic reduction in agency spend. Our turnovers even dropped because we have been able to fill jobs quicker and faster. And for the most part, internally, we've gained efficiencies from our own, talent acquisition team, where it's made their jobs much easier. And I'll give you an example of that. In the past, with our previous technology, our recruiters had to scan through and open up every single resume that came in from the outside and read through line by line to see if the person was a match. And with our new AI embedded technology, it literally does that for them, ranks the candidates, puts the most qualified ones at the top, and they can send that off to the hiring managers much faster. So that's just one example as far as innovation, how we tied into our organizational strategy.
Yuri. Go ahead, Yuri.
Hi, I will certainly echo what Tom is saying. I know a lot of this is certainly a challenge for everyone. We're not immune to any of these struggles. I think when the rest of the world moved on from COVID, we kind of looked around and said, "What are you talking about?" Right? We're still reeling with the after effects and what that has done and how that's disrupted all of healthcare. I think John Maxwell summarized it very well when he said, "Change is inevitable, but growth is optional." Right? And so we choose to grow. We choose to grow differently. And I think many of us could have been heard saying the famous words of healthcare is going to look different, right? Healthcare, things will change, but what does that mean? It means that we have to change. We have to be active participants in that. Some of the changes that we've embraced have been around being flexible and understanding of what the needs of the workforce are. And we understand that when things changed for families, changed for individuals, that meant that we needed to create some type of a change. The 7 to 7 shifts were no longer an option for everyone. Every other weekend was no longer an option for everyone, right? And so the workforce all of a sudden had lots of options. And how do you make sure you're the employer of choice? Is you have to be innovative and creative and come with solutions and be able to work collectively with colleagues who want to join your organization, understanding what their needs are. We've developed flexible staffing models that allow colleagues to get their kids on the bus, right, and come in and join us when they're ready, but then maybe have the opportunity to leave and take care of what their family needs are. We created innovative approaches to our care delivery model, most recently introducing inpatient virtual nursing embedded within our care delivery space that helps offset some of that first year turnover and the loss of seasoned trained nurses by giving them an option to remain at the bedside, even if it's through the virtual lens, right? And support the team be a wealth of knowledge and expertise. And so continuing to challenge the norms and innovate in those spaces has helped us reduce our turnover, increased our onboarding and ability to bring staff back. We call them boomerangs, maybe folks that have left during COVID or certainly have a wealth of knowledge but want to return in a space, creating that alternative care delivery model to support them. So those have certainly benefited us. While some may be still in their infancy, we're certainly seeing the fruits of that change already and excited about what the future will look like, being that differentiator, being something, someone offering something different in that acute care space. So it's certainly helped us.
Before we jump to Mark, can I just ask you a question? Did you, something we've noticed here, what has been your experience with the people, the nurses, the clinical staff that were trained during COVID, mostly virtually, didn't really touch a patient, who didn't spend a lot of time on the floors? Have you had to add anything in terms of onboarding and training to address that issue? Because I've certainly seen it as a qualitative difference in this, in a nurse that was trained and did her practicum during, or his practicum during COVID versus prior years.
Absolutely, and I think we saw that with licensure rates, right? The NCLEX passing rates reduced nationally, right? Because the use of virtual technology and attending clinicals virtually, folks had to adapt and learn. And we know it's distracting, right? How many times have you been on a WebEx call where you're multitasking? You don't focus the same way. And so, the latest statistics said something like 5 generations are now working together in healthcare. And how do you adapt to those needs of 5 generations? And it does take some micromanaging and understanding what those needs are. So some of the things we've done is we know that our off shifts are some of the hardest shifts to fill. And where do you go when you're a brand new nurse? You go where the greatest need is. So we've implemented overnight educators to be able to round and check on new nurses to make sure that when a question does arise in the middle of the night, or they have an opportunity to review a policy or procedure, they have a resource available to them. The virtual nurse model, as I said, is another option where they have a colleague that's available to them around the clock that they can essentially phone a friend that's part of their team and walk through. Maybe it's a new procedure that they haven't completed yet. Maybe it's a new device that they haven't used yet. And certainly those pieces help close the gap and focus on that first year turnover rate, retention rate, feeling a sense of burnout, right? How do you reduce that? It's giving staff the resources they need when they need them to do their job.
That's excellent. Thank you. Okay, back to innovation. Mark.
Yeah, so yeah, I find it very interesting because I think that, you know, as healthcare, we always talk about being innovative, right? I think COVID really pushed that envelope for us. And you know, the company I was working with at the time, and you don't really think about this being innovative, but you know, we had no telehealth pricing at all when COVID hit. We had that up and running in a matter of 3 weeks because we were able to kind of cut through a lot of the red tape of like the process that you go through, you know, the RFP processes, the going back and forth, making sure you got, you know, every I dotted and T crossed, I guess. And so I really kind of think it caused us to be quicker in our decision making, which you don't necessarily think of that necessarily as innovation, but I think in healthcare, from what I have seen, that really kind of helped us move the envelope to be able to do things and actually execute on things quicker than what we did prior to COVID. Within our revenue, you know, within the finance arena, you know, I kind of think like, you know, all areas of healthcare, we saw a lot of people that, you know, decided to leave healthcare. I mean, if it was, you know, people were kind of close to retirement, we saw them leave. We saw, you know, some of the folks coming into it decided that they wanted to go into other areas as well. And so what we've kind of had to do is really look at certain systems and stuff out there that actually complement and help our team to actually work at their highest skill set. You know, take away a lot of the, you know, and within finance, we have, you know, we never really sometimes invested in like fixing systems the way that they need to be fixed. And so are really optimizing what we have purchased. You know, we go out and we'll purchase a system and we'll only optimize, you know, about probably 60% of it. What we're doing is now going back and saying, what should these systems really be doing for us? They've got some innovative functionality that we may never have fixed. Like, here's what's wrong with these particular accounts. Actually, go fix that. And so it points people to directions and actually helps them to be much more productive and takes away again a lot of that mundane, if you will, kind of work that you know the team just kind of finds and rocks in the shoes, if you will. And we hear that, you know, we hear that a lot. We've had to do a lot around flexible staffing as well. You know, like the work from home policy. You know, we require people to relocate. The job can actually be done predominantly remote. You know, a lot of, I think, organizations are looking to go back to, you know, kind of like the office and stuff. But in our organizations, we've not looked at doing that because it does allow people flexibility. There's innovation out there that can help you determine, you know, productivity, if you will. And so why not utilize that and give people, you know, the freedom to, you know, pick up the kids from school or go to a doctor's appointment and stuff and be able to log on to the system later. So, you know, at least within the finance arena, we're really embracing a lot of that innovation to allow that flexibility with the staff.
Since we've been talking about staffing, anyone else, maybe Tom also, as you're in your position, what other innovations are you looking at or are implementing to address you talked about the labor issues that you're addressing, but other innovations that you have for your actual workforce? I was intrigued by what you said about your hiring, using AI in the hiring process, which is very interesting to me. But what about for the people that are there?
So for the people that are there, I mean, you know, Yuri and both Mark touched on workplace flexibility, particularly, let's say, on the clinical side, because what we've discovered, which is no surprise to anybody, is that in healthcare, most healthcare systems have stuck to what I call these types of traditional planning schedules, right? Especially in nursing. And, the reason they did it is because they're used to it and it's easy for the nurse manager to track, right? And so what we're looking at is, for instance, how do we really enhance our processes, policies, and technology around scheduling or flex scheduling, right? Both of my colleagues here mentioned it, and it is extremely important because it's something that when we listen to our employees, that's what they're telling us. I mean, so I totally agree with what Mark said as far as flexibility in the workforce is not going away. I mean, it's here to stay, and that the companies that adopt quicker to it and that actually can leverage their technology to make it easier for their employees. And to be specific, Susan, what I'm talking about, because I oversee our HR model is actually a shared services model. So we push a lot of self-service type of actions out to our team members and people leaders, and giving them, I would say, an easier and more efficient way to, schedule their staff, right, versus the traditional methods, I think is something that we are definitely focusing on, here within our organization. We haven't found the silver bullet yet and the easiest way to do that. But I think a lot of companies are in the same boat. They're trying to work through, for instance, their time and attendance systems and say, how is it that, for instance, our nurses can actually self-schedule themselves, and literally it all be done via, as I said, on their mobile phone, for instance, and all gaps are filled. So it sounds simple in nature, but it really isn't. It's actually very complicated. But it's something that when we talk about technology other than in the staffing arena, we are looking at it from a scheduling perspective. Secondly, we're also looking at how we push out, I mentioned, more self-service utilization and options for our team members. Whether it's, which we already have now, it's something as simple as, looking up your PTO balances to viewing your benefits online. We have those things, but when you're working, and say in Yuri's instance, you have a team of clinical staff, working on the floor, they don't have time to go behind a desktop or laptop computer even, right? They have literally minutes when they have a chance to catch their breath. And if they need to do something on their own, like enroll in their benefits, we have to make it as easy as possible for them. So those are all the things that we are, I don't want to say transitioning to, we have those in place right now in our model, as I know Trinity does as well. But we're actually looking at further enhancing those, and also using AI in the spaces that we can to make those things a lot easier and more accessible to our team members.
Anyone else? I'd be curious, especially from Yuri. Tom mentioned utilization of self-service to make things easier for the employees. What about for patients? Is anyone implementing any self-service options? Are you self-scheduling? Are they self-checking in? Are there any of those options up there?
Yeah, we have certainly looked at spaces where our patients can be just as much a part of that decision making as our staff. One of those is our implementation through our electronic health record. We have Epic, and we've incorporated what's called MyChart, allowing patients to not only view information pertinent to their clinical decision making, but we can actually cascade educational material down to them. So, for example, they're going through a new procedure, a new diagnosis, maybe they're having some testing done. Our nurses can cascade pertinent educational material right down through little modules, right? And then the patient and family can go through them, check the modules that they've completed, and the ones that haven't, the nurses can circle back. So this is one of the few instances where we're actually moving work off of the nurses' plates, right? And engaging the families and the caregivers to participate actively in the care and proactively when it comes to using and leveraging technology. So we have iPads we can provide to them. They can access it through their own personal device right at the hospital, or in the comfort of their own home, or as they're looking to schedule time with our physicians. We've certainly embraced telehealth visits, right? And specific to certain DRGs and how you can reduce some of that wait time and maximize your provider contact time without feeling like you need to leave your home or get out and wait in lines or in the public. So certainly taking advantage of some of those tools and continuing to explore. So even part of our virtual nurse model, the technology, once it's in the room with the cameras and the screens, how far can you take it, right? Can you do consults? Can you do follow-ups? Maybe it's diabetic education teaching. Maybe there are other allied health colleagues can pipe into the room, right, and go through like medication reconciliation lists without being challenged by the geography of a clinical setting and having to walk from unit to unit, room to room. How much more efficient can we get by leveraging some of that technology? So certainly, I think as Mark and Tom pointed out, we've been forced to rethink healthcare. And the one advantage of COVID was we got some gasoline on that fire, and it allowed us to move much quicker through changes where in the past it would have taken us months or years to implement, trial, put into process, right? So, and then we'll continue to learn from them, right? Share. Part of being a hospital, a part of a larger healthcare system, allows us some of that advantage of sharing lessons, right? And copying, pasting, transitioning some of those lessons much quicker as opposed to a standalone facility.
I think also being tangentially a part of the Trinity system, there's a great deal of learning that transcends the entire organization. So we went on the first version of Epic in 2015. We've been on for a long time. We're now switching over to Community Connect. You may have heard about this, Yuri. We were the big fail last year, so we're going in after you guys, but because we were very difficult. But it's amazing when you can harness that. I mean, I'm talking to Yuri right now here as a colleague, but we have that literally every day in our system, being able to harness that. And I'm sure, Tom, at Advantis, because you're located throughout, that you've got learning throughout. I mean, I think it's great. Mark.
Yeah. So is this better? I think I've got a little bit of issue with the microphone on this new computer here. So yeah, I really think that, like Yuri, what you touched on with, like including the patients and stuff, being able to put things on the iPad, on the phone. Part of that is, automation and being able to do self-registering, self-scheduling. And really, it comes down to kind of access into our organizations. Like, how do we use automation, that is out there to be able to open up access to patients, right? I don't know, and I will tell you, I'm definitely not the one that has the answers on that one. But I feel like that is something that as healthcare providers, we still need to figure out a way to solve. It is difficult for patients to get into facilities. It's difficult for them to get in to see physicians, as well. And I think that we got to figure out how we use automation more to be able to open that piece of it up. It's probably more of a comment than anything that is a solution at this point. But, I do feel like that is still a frontier that we've got to solve.
So let's dive a little bit more into AI and big data for a minute. We've had a couple of examples here. I'll tell you one thing, and again, in the small scale that we're doing here, and actually this is going to be implemented throughout Trinity, Yuri, but we've got, most of you probably, your providers use Nuance Dragon for their dictation, and they came out with their ambient scribe a couple of years ago, DAX, and they've now this year come out with DAX Express. So the initial DAX went to some person who actually transcribed and did it. Still AI enhanced. This is now all real time. You're talking to the patient, your iPhone is open, and it is real time through all this learning, artificial intelligence learning, coming up with pulling out from that meeting the conversation that is relevant to the care of the patient. It's amazing. I mean, this is a computer doing this because you're talking about your kid's soccer game or, something else, and it knows that that's not part of this, but it's pretty darn accurate. It's scary how accurate it is. But we are implementing that for two reasons. One, and a big one, is provider satisfaction. This, by implementing something like our AI enhanced dictation system, they can either add more patients, increasing their income, or get home to see their kids at night, which is what they really want to do. And so we're constantly looking at this work-life balance, right? And this is a relatively small investment to be able to either create more production or create more work-life balance. So that's one area where we're beginning to see AI. I know, and I'll be curious to see what Mark has to say about this. There's a lot of application in revenue cycle. There's a lot of machine learning that can help us focus better on the things we have to focus on. There's a lot of application of machine learning in value-based care. Where do we put our focus instead of a shotgun approach? How do we narrow it down to what's going to have the biggest impact? So I'll leave it open to anyone, but let's talk about big data and AI. Where are you going? Mark opened up. Go ahead.
Yeah, so you're exactly right. I think within the revenue cycle finance arena, definitely that has made a lot of progress there. Again, we're like currently right now, I am working with a company that is really kind of helping us determine like denials, right? So I think all of us have experienced, more denials than we'd really like to see. And so really being able to like look at that data, put it together and say, potentially this payer always denies these 3 diagnoses, right? And then what do you do to really kind of provide your appeal back to that? And what it's doing is it's actually putting in the hands of the person that's doing the appeal letter, like information that goes, okay, here's what it's going to take to really win this, right? I mean, I think there's other pieces of being able to start beginning to look at documentation. And there are systems out there currently that can start beginning to look at, like, is this patient going to be an admission? Is this patient going to be an observation patient? And really starts beginning to provide that information based on criteria and based on your insurance contracts. So that really we as providers now have some tools in hand to really kind of be able to get paid and stuff and have the same kind of data that payers have as well. And it gives our team actually the ability to work at kind of like their highest skill set, right? Like, if you give somebody who loves really working, with insurance companies on denials and appeals, you're giving them tools that they've never had before, and it's really becoming pretty powerful in the financial arena for sure.
Yuri?
Yeah, Mark, you're spot on, and we just rolled out a software part of our Epic that does exactly that, right? It proofreads our physician notes, certainly a lot of the dictation notes, but it captures not only parts of the conversation that are relevant to the patient care in the note, but it looks for missing pieces, right? And it'll trigger that next layer of response to say, did you mean this? Or did you want to address this CAT scan result? Or did you want to add this? Because what it'll look at multiple phases of healthcare documentation, both on the revenue cycle component of it, right? Let's make sure we're getting paid for the work. We know our staff work hard. We have to justify it through these notes and submissions to the insurance companies. And let's be honest, our friends at the insurance companies will really do a great job letting us know what words we missed. And so it'll help capture some of that, make sure we're buttoning up our charts tightly, but then it'll also help control quality for us, right? Leverage this AI technology to say, where are we with our quality outcomes? Are we missing something? Is it a group that we could be focusing on, or a service line where we can provide additional resources to make sure we have the best possible quality outcomes in using this AI technology to really leverage that. So certainly very much a part of that. And I think this is only the beginning of where AI can go and how that will impact healthcare moving forward.
Yeah, I completely agree. And I think, right now we as providers are kind of in the infancy use of that. So I think there's a lot of learning, like to be able to do that. I mean, we've not been able to get to a point, at least here, to like sit down with the payers, you know, for the information we got, because like our system is still, if you will, learning what that behavior is. You know, but you know, it doesn't take long for for artificial intelligence to learn those those hotlines to be able to have something to go back to these players in short order. We're just not quite there.
It's interesting. You can see the evolution, right? We've gone from pathways to order sets to smart phrases to hard stops, right? And now it's AI, right? Where it's going to do a lot of the work for you and then remind you where you missed the pieces. So it's a slippery slope, though, right? And it's something that some of our providers will push back on and say that you're pushing me into some cookbook medicine, all right? Like you're forcing me to get out of what I trained to do and how I trained to do this. And so how do you do that? Not lose the identity of exceptional providers, right? And the knowledge that you can't replicate without going through years and years of medical school and residency and fellowship and training, right? But how do you standardize the best of the best and make that your benchmark and continue to leverage the technology in that aspect, not forcing it down people's practice to change how they practice, but helping augment that, right, and enhance what they do every single day.
Yeah,
Yuri, that was going to be my next segue. Is talk to me, and I'm sorry, Mark, you could please jump in, but talk to me about physician buy-in, provider buy-in. This is a huge issue. Some old school that are just not going to trust it. Some new school, they're saying, wait a minute, I've trained pretty long and hard about this stuff. Who's smarter, me or the computer? And everything in between. So talk to me, all of you, about physician provider buy-in. Go ahead, Mark.
No, I just kind of wanted to actually, you asked the question, or made the comment that I was going to ask as well. I can get for providers that have, are seasoned providers, how they're looking at this going like, well, how do you tell me to practice medicine? But the new providers coming into the field now, they're going to be used to this artificial intelligence, and like they're going to practice differently than providers who've been doing it, for 30 plus years. And I think that's going to be something that we're going to have to kind of figure out how that fits. And also, if they're coming out with expectation that every provider is going to have this technology, I think that's going to be the challenge that we have from a strategy standpoint of where do we plug that into our strategic plans going forward from an automation standpoint.
Yuri, anything more on provider buy-in and how we get there? Tom?
Well, Mark hit on a couple key points there, as did Yuri, when you talk about physician buy-in. When I look at that, I'm going to hinge on something Mark said in regards to the newer physicians coming in versus the ones that have been there for a while, right? And I think he sort of nailed it when he said that, because when you look at the adoption of AI and what's going on in the world, right? I don't know if everyone on the call knows this, but next year in 2024 will be the first time in our history where we have more people turning the age of 65 than any other period. And you might have heard the term peak 65 is what it's been referred to as, but that'll have a big impact as far as our physicians that'll be retiring and those that are coming in. And at the same time, you have this AI movement happening, right? And so it'll be really interesting to see the adoption of AI and how quickly physicians may or may not adopt to it. But for my own, I would say beliefs, it would probably be similar to what along Mark said, is such as the newer ones coming in who have been exposed to it, I think will adopt easier versus having to train current workforce on utilizing AI, and as Yuri said, buying in on it.
I will. I'll add that maybe a little bit into the weeds of buy-in is you have to be able to clearly articulate the why, right? When you expect change and adoption, what's in it for me, right? That old saying is, how are you going to make my life easier? How is this going to improve how I manage my patients, is it time, is it quality, is it revenue, right? And being able to tie that back to the why helps get buy-in. I'll share an example. When we first rolled out the AI on the physician documentation and the gaps identified, we had to draw examples where providers missed certain key phrases and what that cost us, right? How much revenue was lost or reimbursement that was not fulfilled because of very key phrases, key terms that were missing. And certainly drawing that correlation, right, helped. And then also the quality outcomes, right? We know you can't replicate years of experience. But as a new provider, how do you get them there faster when they don't have those years, or maybe, as Tom is pointing out, those colleagues may not be there in 5-10 years to train them? Embedding some of these stop gaps and some of this safety net, right, allows them to perhaps train differently and experience things differently and learn from the technology, as opposed to waiting for a peer or somebody with years of experience that can kind of pour into them, right? The traditional sense of how we learned and shared information. So I think it's going to be very interesting, and certainly a time to watch where technology will start to replace some of that seasonal experiential information that we used to lean on.
And I think that with some of the more seasoned, I will say, physicians, some of the obstacles I've run across in the ambulatory setting is they don't want to. I've got one doctor who bills nothing but 99213. For those of you on the call who may not be familiar with coding, that's just the basic mid-level code. Doesn't matter what he does, pre-op physical, new patient, 99213. And I sat with him one day, and it's not about money for him, right? So I sat with him and I said, first of all, if you're seeing someone and they've got, X, Y, and Z, and I went through some of the coding requirements, I said, do you see those patients? He said, yeah. And I said, well, you should be billing a 99214. Didn't hit home. And then I said, when you see a patient for the first time, do you realize you can bill a 99203 or 04? Didn't hit home with him. And I said, George, you could make more money if you did it that way. And that just shut him down. Then he was never going to bill anything but a 99213. So I think in some cases, I let one battle go to win the war. So I'm going to focus on the people who want to, but you're always going to have some like that. It's not always simple. But I do find my younger providers are eager to embrace a different way, because maybe they haven't had, as you were just saying, the experience or someone that they're eager to embrace. Give me a way to work effectively. And they embrace that. Tom, I'm curious, you talked about the enhancements you made in being a chief people officer. Do you find that people are afraid of losing their jobs because of AI and big data? I think the way to approach it really is it's enhancing, not replacing. But what are your thoughts?
I mean, that I'd be lying if I said that I haven't seen that reaction before. That is an initial reaction, but it's exactly what you said, Susan. It's enhancing your job. It's enhancing your ability to perform your job. It's making, your job easier, right? To that extent. I mean, it's no different than when we launched, the AI technology that we use here at AdventHealth. It's called HiredScore. I know many organizations have it and are familiar with it, but our recruiters, just like let's say in the physician discussion we just had a few minutes ago, initially were a little resistant to it because they didn't trust it. They didn't trust maybe the ranking of the candidates, for instance, right? They didn't trust that it was pulling the right candidates from your funnel, right? Your candidate funnel. And, over the last 7 months, based on data and the data that it produces, we basically have met with our teams and have shown them the data. And if you heard the term data doesn't lie, which it doesn't. And it's shown that those recruiters that have adopted to it and are using it have become even more efficient than they were in the past. And so when you explain it in that manner and show that it actually can make you better at your job, I think it tends to have people, react and look at it very differently. And in fact, having, your own team members explain it to other team members is even better than someone like me explaining it to them. And so, peer to peer, so to speak. And that is something that we found to be very effective when introducing technology like that. So.
Very good. We have 5 minutes left, and I'd like to ask each of you to answer a question that's not on the list, but something that's just sort of come up as I've been thinking about it. And by the way, there have been some questions from the audience. You can see them down there. Some of them are directed at individually at you for some of your resources. Hopefully you can respond either now or after in the community. But I'd like each of you to reflect on, what do you think is your biggest challenge you will face in let's say 2024, next year? What is the biggest challenge that you personally in your position will be anticipating, and what are you doing to prepare for and be able to work through that challenge? Who wants to go first? Go ahead, Yuri.
I think part of our challenge will continue to focus on the labor struggles and how do you continue to innovate. I think we can accomplish many things with the right people in the right places, right? I think it's how do you do that when you're competing against options out there for folks. And I will never begrudge anyone for looking what's best for their family, but how do you make your organization that right choice, right? And understanding those needs, as Tom pointed out, with the age gap and the disparity in workforce changes, we have our own internal challenges with our senior staff who learn one way, right? Our younger staff who learn another way. And what do you continue to invest in and focus in so that you not only recruit, you also want to retain? And so certainly, as we have as most organizations who have a lot of innovations and strategic priorities on the books that we want to accomplish, I think labor stabilization continues to be the #1 priority for all. And part of that is a lot of the topics we already addressed today, right? Innovation, AI, engaging the workforce differently, creating different care delivery models, collaborating with colleagues and physicians to accomplish the same outcomes, great quality outcomes. So certainly my focus will continue to be having my eyes and ears on the workforce as the changes happen, and what do I need to do to support them.
Excellent. Mark, you were there you go.
Yeah, so I would definitely agree with that. I think labor for sure is going to continue going into 2024 and maybe even beyond that one. I think, you kind of touched on it as well, is for those of us that are in the acute side of the business, how do we start beginning to really kind of transition to more of that ambulatory service? I mean, that becomes that's a revenue play, as well as a market share play. And what do we really do with that? Or how do we balance that going forward and adjust our cost structure, if you will, to match that? And then the third one for me is really payer performance, and how do we truly get paid for the services that we're providing? I think those three are really going to be the things that keep me awake now, and they'll probably keep me awake in 2024.
It's easy going last because I'm going to just say I agree with everything Yuri and Mark said and everything that we had discussed on this call. I mean, there's a lot of challenges to navigate through. From a people perspective, I think I'll end by saying this. Our organization has been so heavily traditionally focused on the patient experience, which we still are. I mean, we utilize technology such as Epic, as Yuri mentioned, and other technology. But at the same time, COVID really shined a light on the fact that we need to continue to focus even more so on the team member experience. And so it's a balance between the patient experience and team member experience, and having those aligned and moving literally, on the same tracks at the same pace, so to speak. And so, that's at a very high level, but I think that is one of our greatest challenges, and we're trying to do so in a period where we're experiencing tremendous growth as well. And so it'll be extremely important to navigate through all those challenges that we discussed today, but at the same time, making sure that our patient and team member experience, are both viewed together.
I think that's a great way to summarize this. And we are right at time now. So I want to thank you all so much, our three panelists, and to the audience. Thank you for being part of this, and wish you all tremendous success in the future. Thank you.
Thank you.